Hi, I'm Dr. Owen Muir, and I'm the director of our neurostimulation service. Join me as I take us through the Brooklyn Mines COVID Preparedness Protocol, so our TMS patients can get the treatment they need with the safety that we all expect. We're going to do this by having standardized procedures for all technicians and patients receiving treatment here at Brooklyn Mines. When anyone comes into Brooklyn Mines offices, we're going to start by checking their temperature. This includes staff and patients. This way, we can know at the door if someone's likely to be a carrier and ask them to leave promptly if that's the case. All of our TMS technicians will be wearing face masks and washing their hands regularly between every patient. This, using soap and water, helps reduce the chance of our hands acting as a way to spread the chain of infection. Soap and water is one of the best disinfectants we have, so at Brooklyn Mines we use it. We also know that COVID-19 is a respiratory infection, which means that by breathing in droplets coughed or sneezed by others, we put ourselves at risk for infection. Our technicians will all be wearing face masks for the safety of both our patients and themselves. This way, we can reduce the number of affected individuals and the number of people who are at risk of transmitting that infection should they become exposed to an infected individual. Keep in mind, social distancing is not about no one ever getting exposed to COVID-19. At this point in time, that's impossible. What we are doing with social distancing and careful procedures around TMS for those who do have to come in is keeping them distanced from other people to the extent possible and reducing the chance of a transmission event while they're in contact with someone else. This helps slow down the rate of cases who become seriously ill with COVID-19 to a level that our health system can deal with. One of the reasons Brooklyn Mines is keeping our TMS running is to help people dealing with mental illness receive treatment out of the hospital setting so we can reduce the burden of emergency visits to hospitals for reasons other than COVID-19. This way, we're doing our part to maintain the ability of the healthcare system to keep up with the challenge. This way, when you sit down for TMS at Brooklyn Mines, you can take a moment to relax. We're taking all the steps necessary to reduce the risk of exposure to COVID-19 and other infectious agents. Thanks so much for joining us for our video giving an overview of the safety protocols we're using to reduce the rate of infection and increase the effectiveness of social distancing on the COVID-19 outbreak at Brooklyn Mines. We want to make sure we're taking care of our patients' mental health and their physical health and working together with the public's health system to preserve capacity to take care of people in acute distress.